Good afternoon, everybody. My name is Võ Thị Kim Anh. I'm from Vietnam, and today I will present my paper titled "Integrating Artificial Intelligence with Traditional Chinese Medicine: Enhancing Disease Diagnosis through the Four Diagnostic Methods." And the highlight of the presentation today include introduction-related works, problem definition, proposed methodology, results, and discussion, and then conclusion, future scope, and references. When you talk about the AI in traditional Chinese medicine (TCM), we can see that they are preaching AI with traditional Chinese medicine the methods. But the other side, we have the challenges like diagnosis relies on subjective practitioner judgments. So it's normally for traditional practitioners. They take time and efforts and focus to diagnose the patients. But rather, we have opportunity for AI to standardize, quantify, and enhance diagnostic accuracies through some surveys papers. The later slide will present for this. So today, with this presentation, I will show the 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 real use case study preaching with AI through TCM. Yes, so in TCM, we have the four diagnostic methods: observation, auscultation, and olfaction integration, taking pulse. So for observation, so the practitioners they inspect the patient, the overall well-being, the color complexions, um, etc. And and also the escalation of affection, the patient's voice, breathing pattern, and breathe as analyzed interrogation, checking with the patient's illness, symptoms, sensation, experience, etc. And lastly, it taking the pulse. The changes in the patient pulse is due to determine his C and blood circulation. And uh, in the surveys we we did through the academic paper, we see that there are many CNN applications out STM networks, a case story like diagnose the tongue, and it can achieve a very high accuracy, 92%, for example. And for application with CNN, convolutional network with deep learning for medical image analysis in diagnostics. And for RTM networks, it's a time series analysis for post waveform interpretation. So the problem is currently we have practitioners they diagnose the patient symptom very subjective. So subjectivity is a practitioner problem. And then the diagnostic variabilities. So maybe the same symptom, the same uh, information input for diagnosing, but different practitioners they could have different medical plans, treatment plans for the patient. So this that's the limitation for this TCM. Also for the time incentive processes. So at the time, it takes a lot of time and focus for examination of a practitioner and a patient because it takes time for them to focus to take the taking the pulse and also the others observation Yeah. And in the side of AI solution also have problem. Yeah. But with AI support for TCM, it can reduce the bias. Yes, improve consistency so to make the diagnosis of the TCM practitioner can be less biased, and also it can keep consistency and accelerate diagnosis. It is time saving for practitioners, and still have the challenges for this integration between AI and TCM. That's data standardization, model transparencies, because how to persuade to the practitioner they could rely on or trust the models of AI models, and also for authority, and also the managers and the uh, even the practitioner, they could understand, and with the AI explainable models, like way to explain for them to better understand and trust the model. Integration complexity, yes, it's not simple, it's not easy. Of course, because integration is it's it requires the linking between the technologies and the traditional the knowledge very subjective. Yeah. And on the other side of the slide, you can see there are figures number three comparison of traditional and AI enhanced diagnostics workflows in DCM. So from the right hand corner, we can see from top to the bottom, we have the process that nurses follow the tradition. But the other side, on the left hand corners, left hand of the figures on the slide, we see when we can integrate AI to support for practitioner to make the diagnosis accuracy, consistency, and also time saving. Because AI enhanced diagnostic workflows, collection image, sound, pass through the machine. Of course, it's a supplement for the practitioner. And later on, with the modules, AI can support for practitioner in analysis and give out the algorithm and the modules. So at the whole thing, we can see that it's a problem there, and how to compile, how to integrate, how AI and technology can support for practitioner in TCM. And here are proposed methodology or model we given to the paper. Yes, we have image analysis and waveform processing, and then NLP is extract the insight through the symptom interpretation and diagnostic the outputs. So we can see the figure AI workflow for TCM diagnostic. We can see the patient on top, the patient data input with the tongue images plus waveforms, and then it will separate to different, we can say, module to analyze the tongue's images and also the birth waveforms, and then they compile together. We have a feature extraction and then diagnostic prediction. Practitioner can validate the outputs from the models. So AI can support for the TCM like a tool of supplements. It's not replacements, you can say. And the treatment plan development is followed by practitioner validation. And result we got from the survey of the case studies to TCM diagnostic. with the tongue image, post waveform analysis, adaptive precision personalized treatment plan, we have improvement through the paper. We can see with the really high accuracy. Yeah, and also we have the the detect and also prediction for cardiovascular risk prediction through the post waveform analysis and adaptive prescriptions, personalized treatment plan, 30% improvement in symptom reduction when we they analyze adaptive HERPO. This is some kind of a typical example. And here we see a bigger, okay, I can say a really bigger figures. We start at the data collection, and through the traditional diagnostic methods, we have inspection, tone analysis, and articulation and olfaction. We have sound and smell analysis, even inquiry the patient history and symptom, and the patient is a post analysis and follow this diagnostics method of TCM. We continue with the AI modules interfere in the process. We can have AI-based tongue image analysis and so AI-based sound processing, AI-based NLP for symptom analysis, AI-based post data evaluation. And how come we compare together with the, yeah, of course we have the data structure and algorithm from, and also consider with the ethical consideration, data privacy and bias, and that he gave us decision support for practitioners. And the final diagnostic and treatment plan, patient outcome monitoring, and enhanced TCM care with AI. So the whole process, we can say, technologies, AI model and systems support for the practitioner. It's AI TCM is like a complementary approach, yes, to maximize the benefits of both AR and TCM. And enhance the diagnostic, improve accuracy, consistency, and speed. And for clinical support, AI can assist rather than replace practitioner. Standardization, quantifiable metric for traditional methods. And what about the features? Feature we have a wearable diagnostic. We can see device, yeah, and toolkits, continuous health monitoring through AI powered TCM, explainable AI, transparent diagnostic reasoning aligned with TCM principle, personalized medicine, individual treatment plan generated from AI TCM insights, and global standardization, international protocols for AI enhanced TCM practices. Yeah, it should be followed. And the cooperation between the practitioner, everybody, the managers, and the authority, and also in global. And the conference like our conference happening today, we become having a discussion about this and advice for the authority and committees. And here's some references are from the typical from the for paper. Thank you.